people who truly form the protection network to life, the people from the HMBs. It's a privilege. It's a privilege to work in favor of a cause that is so dear to us. Breastfeeding during the pandemic, okay, the fear exists, it's real, but our babies need to receive the best of our food. So that's why our work has continued. The donation of human milk in my country has been very, very important because it has been assisting to recover babies, to help recover babies in our hospital ICUs. And it's important because the donation of human milk now in Costa Rica, and there was an increase in the demand of the human milk. And so the babies, they truly need it. And so this human milk donation has been so important. But at this moment, it has been even more important during the pandemic, okay? And we have been helping our mothers to breastfeed their babies and donate milk. In this phase of the pandemic of SARS-CoV-2, we were able to inform the donors of the protection measures, the security measures. We were able to disseminate this information to the mothers. We updated their knowledge about the security and safety of breastfeeding, even for the mothers who tested positive for COVID, okay? Following the guidelines from the WHO, and we were able to maintain the supply of human milk, okay? And we were able to help recover the premature babies and the babies that were in our ICUs. So the Human Milk Bank for 17 years now has been essential so that we could nourish our babies at the neonatal ICUs. And so it has also been contributing to the nutritional and food security of our babies, newborn babies, and the babies in the ICUs. And so we are carrying out a very rigorous control, quality control, okay? And we have been following up the mothers so that they can feel safe and secure, that they can breastfeed their babies, even if they have tested positive for COVID-19. The Human Milk Bank, okay, has been sharing knowledge and information and assisting all of our premature babies and underweight babies. We have been able to reduce our mortality rate that in the past remained between 22%, 22, 23, 24 babies per 1,000 babies in the past, and we have been able to reduce that mortality rate. So in Colombia, it is a country, and so some of our babies that are in the hospital, they didn't receive as much human milk as necessary because some of the mothers had to be taken far away from their babies. And so we started receiving pasteurized human milk from the human milk banks in Colombia, and this made all the difference for our babies. The donation of human milk is an individual act, but the power that it has, it's a collective power. It's a way of saving lives. And so the mother donates freely the human milk after they breastfeed their own babies. And so this practice is a new one in Mozambique. It's only done in the city of Maputo. but we want to implement this practice all over our territory because it's the only sustainable way to maintain the food security of millions of babies that we have in Mozambique and those that cannot be breastfed directly.
COVID que hemos vivido todos a nivel mundial y estamos viviendo, pues en el brote, justo en el pico.
Everything that we're living through, we have some restrictions so that the more vulnerable kids can receive donated milk, but we haven't had any lack of milk due to the generosity of the donors. We've had more milk than ever, and we haven't had to restrict indications, and we've been able to receive more kids because, and has helped a lot the situation.
El banco de leche está ofreciendo su servicio de manera normal a pesar del
So the
confinamiento.
HMBs are offering their services normally. We get them at your house, so we guarantee the hygiene and safety due to COVID. We cover mouths, keep distance, sterile materials, sterilization of the vials, and work continuing the WHO and the Ibero-American issues of HMB. We follow all the protocols. We have talked to all society and especially the mothers as regards donation of milk. Everything in America and Argentina, you can count with our HMBs. The network of HMBs is a great example of solidarity and a space for exchange of experiences and innovation that saves lives every day of babies. Certainly, breastfeeding is the most cost-effective public action and the greatest act of love we can have that parents and families should support. Breastfeeding will always be in any country, in any region, in any part of history, the reason why we have healthier kids. It is important to remember that breastfeeding is not a simple action. The Brazilian model of HMBs is recognized worldwide, including this year, was conceded by the World Health Organization. One more prize in the person of Dr. João, which I congratulate for years of dedication to this cause. Now, this partnership of PAHO and World Health Organization and the HMBs is stronger than ever. Donating milk has always been safe and continues to be so.